Welcome to the Depth Dive. Today we're taking a whole stack of research, notes, insights, and turning it into something really useful for you. We're looking at spinal bone spurs. It's a condition that's way more common than people think, especially once you get past 60 or so. Our goal here, to get past those sort of vague aches and stiffness you might be feeling and give you some real understanding and practical strategies.
And that's so true. Those aches that just won't quit, feeling like you can't move the way you used to.
Yeah.
It can be really frustrating, can't it? And yeah, often it just gets, chalked up to, oh, I'm just getting older. But like we're going to explore, these feelings could actually be clues, signs of spinal bone spurs or osteophytes as they're technically called. Understanding what they are is really the first step.
Okay, so let's dive right in then. Have you ever stopped and wondered, is this nagging ache really just age? Or is it something more? Because that term bone spur, it sounds kind of alarming, doesn't it? Like something sharp sticking out. But here's something that might surprise you. They're usually more like smooth, rounded bumps. And knowing that changes things, because the pain often isn't the spur itself, it's the inflammation, or maybe the pressure it puts on things around it, that secondary effect.
Exactly. And what's really fascinating, I think, is that loads of people have bone spurs and, well, they feel absolutely nothing. No symptoms at all. They only really become an issue when they start impinging on nearby structures, maybe pressing on a nerve or a muscle or sometimes even the spinal cord. It's a really classic case of the body trying to do something helpful, but maybe going a bit too far. See, when the cartilage, the padding in your spine starts to wear down, your body senses instability. It tries to fix it by laying down new bone to stabilize things. But sometimes it kind of overshoots and makes a bit too much bone, and that extra bit ironically ends up causing the problems. It's a strange biological thing, really.
Wow, okay, so understanding that really shifts the perspective, doesn't it? It moves us away from thinking, oh, well, I just have to live with this. Understanding the why is the key first step to managing it better, to feeling better. And as we start talking about why these spurs form, maybe you're already thinking about your own day-to-day life. Like, is there something you do, an activity that seems to make your back feel worse? Just kind of keep that thought in the back of your mind as we go deeper.
So let's talk about that why. Why does the body even create these bony bits? Well, based on what I've seen over decades in practice, the number one reason is just the natural process of aging, wear and tear. Think about your spine, right? It's like building blocks stacked up, the vertebrae with these amazing cushiony discs in between. That's osteoarthritis of the spine starting. Over time, those discs can lose some water content, they get a bit thinner, and the cartilage on the facet joints, those little joints connecting the vertebrae, can start to break down too. When that happens, bone can start rubbing on bone, and your body goes, uh-oh, damage? So it starts laying down new bone to try and stabilize everything. But like we said, sometimes that protective mechanism backfires by making a bit too much bone.
Right. And it's not just osteoarthritis doing this. Another big factor is something called degenerative disc disease. As those discs lose height, get flatter, the space where your nerves run through gets narrower, plus the ligaments holding everything together can get a little looser. So the body tries to firm things up by creating these spurs. But again, that can end up squeezing the nerve space even more. And we should also mention things like repetitive strain or even old injuries.
Oh, absolutely.
Maybe you had a really physical job for years or an old sports injury you forgot about. That past stress can definitely contribute to spurs showing up later on.
And beyond the physical wear, how we actually, nourish our bodies and how we carry them matters too. For example, if your diet is low in certain things, maybe vitamin K2 or magnesium, maybe not enough protein, it can affect your bone density, your cartilage health. Now, a deficiency won't directly cause a spur, but it makes the spine, less resilient. It can speed up that whole degenerative process.
Yeah.
And definitely carrying extra weight puts constant extra stress on the spine. That absolutely accelerates the wear and tear.
That makes sense. So given all that mechanical stress, where do these spurs tend to cause the most trouble? Is it usually the neck, the mid-back, the lower back? What do you typically see?
Yeah, the thing about bone spurs is they can be sneaky. They often don't cause any fuss for a long time. They might be there for years, quietly. Symptoms really only start when they begin to press on something, a nerve, maybe a muscle or the spinal cord. And for folks over 60, it's so easy to just brush these signs off as, oh, it's just aging. But the specific feeling can be a really important clue.
Exactly. And that's where knowing the location really helps understand the symptoms. So if the spurs are in your neck, the cervical spine, you might feel this kind of persistent, dull ache, maybe stiffness, trouble turning your head fully. But the real giveaway, sometimes you get tingling or numbness, maybe weakness that travels down into your arm or your hand, even both arms sometimes. That's called radiculopathy, basically a pinched nerve root. I've heard people describe it like suddenly finding it hard to hold a teacup because of a weird tingle, or waking up and part of their hand feels numb. Strange sensations like that. Now, if we move down to the lower back, the lumbar spine, which is actually where most symptomatic spurs happen.
The most common spot.
Yeah, that often causes back pain, especially when you're walking or standing for a while. And that pain can shoot down into the buttocks, maybe down the leg. People often confuse it with sciatica.
Right.
But here's an interesting clue for lumbar spurs. Sometimes the pain actually feels better if you bend forward, leaning over a shopping cart, for instance.
Yes, because that flexion can temporarily open up the space around the nerves a little bit. And looking at the bigger picture, if these spurs get significant enough in the neck or the lower back, they can contribute to something called spinal stenosis. That's a narrowing of the actual spinal canal. And that can lead to more serious problems, maybe trouble walking, feeling off balance, or, in pretty rare cases, but it's urgent if it happens, losing control of your bladder or bowels. That needs immediate medical attention.
So these aren't just random pains, are they? They're really specific signals your body is sending. Paying attention is key. Where does it hurt? What makes it worse? What makes it better? That's why being really detailed when you talk to your doctor is so crucial. Don't just say, my back hurts. Try to describe it, you know? Don't ignore that little tingle or that specific type of ache. It's your body talking.
Absolutely. And of course, just a reminder to everyone listening, this is all for educational insight. Always talk to your own doctor for diagnosis and before making any health choices.
Definitely. So, thinking about those signals, maybe think about one small tweak you could make in your daily life right now, something to ease the strain on your spine. Could it be a better chair, or maybe just how you sleep?
When we talk about managing the discomfort from bone spurs, my approach, really shaped by about 2 decades working with traditional Vietnamese medicine, is always to look at natural and holistic options first. I really believe in helping the body heal itself, finding balance through, simple, proven practices, things that support long-term health and aging well.
That's a great philosophy. So let's start with one key area you focus on, movement. Which sounds odd, right? Because if you're in pain, you probably want to just sit still.
Exactly. It feels counterintuitive.
But being sedentary is actually really bad for a spine with spurs. Gentle, consistent exercise is, it's incredibly powerful. It helps flexibility, strengthens the muscles that support everything.
And I want to be clear, I'm not talking about, running a marathon or heavy weightlifting here. Not necessarily. Think more about gentle, flowing movements, things like specific stretching routines, maybe yoga or Tai Chi. These can actually help decompress the spine, create a little more space for those nerves. I remember this one patient, he was in his late 70s, used to run marathons, came to me just feeling totally beaten down by his back pain. We got him started on just a simple, 15-minute stretching routine every morning, nothing crazy. And within a few weeks, he called me up, almost laughing, saying he felt like he'd gotten his mornings back. It's amazing how much relief simple, gentle movement can bring. It's about nurturing your body, not punishing it.
That's a fantastic story. Okay, so movement is key. What about nutrition? You mentioned food as medicine earlier.
Yes, absolutely. We want to focus on bringing anti-inflammatory foods into your diet regularly.
Okay, like what specifically? What should people look for?
Well, simple things you can add to your cooking are great. Turmeric, ginger, garlic, these are huge in Vietnamese cooking, and they're known for being really good anti-inflammatories. Beyond that, making sure you get enough vitamin D and calcium is important too. They're fundamental for bone health overall. Now, they won't make the spurs vanish, let's be clear, but strong bones provide better support for the whole structure, making it more resilient.
Makes sense. Where do we find those?
Think leafy greens, fatty fish like salmon is great. Fortified foods often have added vitamin D and calcium too.
All right. And what about other therapies? Things like acupuncture or massage, how do they fit in?
Oh, complementary therapies can be remarkably helpful for managing symptoms. Acupuncture, for instance, is a pillar of Eastern medicine. By stimulating specific points, it can be incredibly effective for pain relief. I mean, I've really seen it work wonders for people with chronic back issues, sometimes when nothing else seemed to help much. And then there's qualified massage therapy. That can be hugely beneficial too. It helps relax muscles that might be tight or spasming around the area. That relaxation can take pressure off nerves, and it also improves blood flow, which is always good for healing.
Simple things too, right?
Absolutely. Even just using a heat pack or a cold pack can give you pretty significant immediate relief if you've got muscle spasms, or local inflammation flare-ups. The real key through all of this, though, is listening to your body. Finding the combination of these things that works best for you. It's a very personal journey. I always tell people, be a bit of a detective in your own life. Observe, experiment gently, see what helps.
This whole discussion has really been quite something. We've gone from thinking bone spurs are just, part of getting old, to seeing how the body tries to heal and finding these natural ways to get relief. It's empowering.
That's exactly what I hope people take away. Please don't see this as just a diagnosis of what's broken. Think of it more like a roadmap, a guide to what's possible, what's right for you, those aches and pains. Maybe think of them as a call to action. Your body is asking for a bit more care, some thoughtful attention, maybe some gentle wisdom applied. We have a saying in Vietnam, Suk Lavang. It means health is gold. It's so precious. And truly, it is never too late to invest in your health.
That's a really powerful way to put it. Health is gold. So for someone listening who's maybe felt stuck, thinking their pain was just inevitable, what's the very first tiny step they could take to start being that curious scientist for their own body?
Just start small. Pick one single thing from our chat today. Maybe it's trying that 15-minute stretch tomorrow morning, or maybe just adding some turmeric and ginger when you cook dinner tonight, or even just noticing your posture more often when you're sitting. Just one small change.
So think about it. What's one thing, just one, you could try this week to improve your spine health? And imagine how sharing your story later, your path to feeling better, could inspire someone else.
You absolutely have the power within you to live a life with more energy, more comfort, more purpose. Age is not the barrier we sometimes think it is.
And just one last reminder, of course, everything we've shared is for educational insight. Please always, always talk with your own doctor for any personal medical advice or decisions. So here's a final thought to leave you with. Now that you understand a bit more about how your body is actually trying intelligently to heal itself, what new perspective might you bring the next time you feel an ache or pain? Maybe not seeing it just as a limitation, but as a signal calling for informed, thoughtful action.